father of preventive cardiology and father of EECP, which is extremely beneficial to remove your plaques. So I would want you to explain principle of EECP, explain how can we prevent cardiological, the heart attack by using all these complementary treatments.
See, there are basically 3 complementary treatments we are using. In fact, I'll say 4. Previously we were using 3, now we have added 1 more. And that 1 more is ozone therapy. We started in 1994 with chelation therapy. We named it artery chelation therapy because we are basically dealing with the arteries. The purpose of artery chelation therapy is, it is given intravenously. The purpose of artery chelation therapy is to remove the toxins from the body. We are basically removing the heavy metals. Now it is well known that heavy metals contribute to the formation of plaques and lead to blockages. So once we are able to remove them, we are able to decrease or stop the formation of new blockages. At the same time, we expect that the previous ones will decrease. I won't say clear out, I'll say decrease. Now once we decrease the blockages in the blood vessels, you have got some big blood vessels, you have got some very, very minor ones, very small ones. The big ones are 3 in number, then you have the smaller, and the smallest one in millions. So if you have a blood vessel that big, we try to clear it. It will take ages to be cleared. But when you talk about small blood vessels, it will be cleared very soon. And these small blood vessels, they form a network. So if we are able to clear those or enhance the circulation in them, it's going to do the same thing as bypass is going to do. So this is how we are doing about the chelation therapy. Then in the year 2002, we introduced ECP in our setup. And with ECP, 2 years before that, we also introduced cardiovascular cartography.
So just to, can you explain the full form of ECP? Because the customer or the patient would like to know what they should look for. And at the same time, can we please illustrate about collateral developments also?
Right. First, I'll talk about the collateral because that is very important. We see so many patients who have got 100% blockages when they do angiography. And the patient says, I've never had a heart problem. I've never had angina, I've never had chest pain. And then we also see patients who have got clear arteries and they are having angina and chest pain. So there's something missing. That missing link is these collaterals. When you have sufficient collaterals, they do the same work as bypass surgery. So if you are able to have good collaterals, half your work is done. And that's nature's way of creating. As blockages develop, the collaterals also start developing and a balance is maintained. As long as this balance is there, as long as the amount of blood decreased by the blockages is compensated by the blood flowing in the collaterals, nothing is going to happen. But sometimes what happens is the rate of the plaques forming and the collaterals being formed is not balanced. And when this happens, that is when we start having the angina. So we are able to keep that balance. Not we, as nature itself is doing it. Till then, nothing happens. That's why normally up to 70% blockage, nothing happens because collaterals have developed. If your collaterals are still better, then 100% blockages, still nothing will happen once the nature has already treated you.
Yes, yes. So EECP helps you in developing collaterals?
Yes, ECP helps in developing the collaterals. ECP's full form is External Counterpulsation. Some call it EECP, the actual name is External Counterpulsation, but somehow the EECP word has become more popular.
That is electronic external counterpulsation.
Enhanced external. There are a lot of other names, IECP, SECP, but basically it is external counterpulsation. In this, cuffs are wrapped around the legs. The better machines also have around the arms.
Yes.
And these compress and relax, inflate and deflate, timed with the ECG at the precise time when the heart is getting its own blood supply. So when this pressure is transmitted to the coronary arteries, what happens is when you increase the pressure, the arteries dilate. At the same time, there are millions of small capillaries in our body, in our heart, which God has given as reserve but did not open. Maybe if we had exercised more, they may have opened. Maybe when centuries back, when we were in the jungles hunting, we had much more exercise, they would have opened. But with our sedentary or partly sedentary lifestyle, they don't open up. So ECP helps opening them. And also, it helps stimulate formation of new blood vessels. So all these together, they increase the blood flow and they act as a bypass. So we call it natural bypass. But we are using nature's capacity to do exactly what bypass would do. In bypass, you have take a vein from the leg and put it around. And here we are using our own. It is like you want to go from Delhi to Ludhiana or any other place. You have the GT road, the main road. If that gets blocked, you have a lot of arteries, that is roads through the villages. If we develop those roads, right, whatever the blockage on the GT road will be ineffective, so I'll still be able to reach Ludhiana.
Wonderful. So the chelation, ECP, what else do you change the lifestyle? What all?
Along with that, we are also using ozone therapy, and that's also adding tremendously to our results. And we have another, that is the latest technology as far as non-invasive cardiology is concerned, that is ESMR, Extracorporeal, Shockwave, Myocardial, Revascularization. In this, with the echo, we focus ultrasonic waves on the part of the heart which is getting less blood supply. So it is like if we slap someone, you see redness because blood flow has increased. If we give a cut, when it unites, the capillaries from this side and that side both develop. So if you give appropriate stimulus, new blood vessels will develop, and this is what ESMR is doing.
Wonderful.
And of course, the lifestyle plays a major role. Without lifestyle, everything is going to fail.
So, kind of integrating together all the healing modalities for the heart problem. Basically, you have to clear the calcium which is deposited, which we know it as a plaque. So that needs to be done. Along with ECP should be done. Along with that, ozone to give more oxygenation. At the same time, ESMR is also very helpful.
Ozone has a very, very major advantage.
Okay.
It is more affordable by the Indian public than all the other three.
Yes.
And that is what I think the India's biggest problem is not the disease, it is poverty. So in that, from point of view, ozone I think is a wonderful treatment and it should be promoted.
Thank you, Dr. Sibia. That was
Thank you,
wonderful
Dr. Mili.
insight.
Thank you very much.